بنبلش بتيتاني. So what you've just seen in the image was tetanus, مش هيك؟ Tetanus. Generalized tetanus, that is. وراح نحكي على botulism وراح نحكي على listeria شوية. حكينا على listeria بالmeningitis. We will touch on it again more from a microbiology perspective. لو حدا يطفي أول ضوء بكون كويس حتى مشان تشوفوا. Can you try from the back الله يسعدك. وآخر شيء راح نحكي على الليبروسي. شو يعني الليبروسي بالعربي؟ بيعرف شو يعني الليبروسي بالعربي؟ حدا يشوف لي شو يعني الليبروسي بالعربي؟ كأنه الجذام. أيوه خلاص كثر خيرك. Okay. Clostridium tetanus أو tetany is caused by a toxin اسمه مكتوب هاي Tetanus spamine شي زي هيك صح؟ Tetanus spamine produced by Clostridium tetany. طبعا هون في غلط. شو الغلط؟ دائما لما نكتب the nomenclature for any microorganism we have to italicize it and it's not English, it's Latin. مش هيك؟ مشان نفهم اللي بيقرأ انه you're not reading English, you're reading Latin. So we have to italicize it. However, طبعا tetany it used to be شايفين هون كيف؟ In the 1947 with the 1952, the 1957, you can see a drop in the incidence of tetany as well as the fatality, the number of death from tetany. تمام؟ Because thanks to the DTaP, part of اللي هو ايش؟ الvaccine in the 1940s. بالعادة we get tetany from an injury, from a puncture wound. This is the most common type. But we'll cover the others as well. So acute injury, injection of tetany. The second two statements I'm not a big fan of. لأنه بطلت شغلة developing with developed world, مش هيك؟ So we are all in more or less in a civilized society. But there are certain areas where it's more poor sanitation, less hygienic, then they're more prone or susceptible to certain diseases. That's what these two sentences are saying. Or at the end, we're mentioning something important. Who in the US, this is based on the statistical data in the US, it's probably true for any part of the world, which is when a waning immunity, when the immunity is weakened and you miss your booster shot of tetanus or DTaP vaccine. نقول احنا المفروض ناخذه كل كم سنة؟ كل 10 سنوات. People at risk بيحكوا انه كل 5 years, بس generally speaking every 10 years. So الكلمة هون ايش؟ waning immunity. So Clostridium tetany is an obligate anaerobe produces a spore. Spore in this case is a terminal spore. Botulism is subterminal. Okay? Produces the toxin. The toxin, the story here, starts from the periphery. That's the port of entry. Okay? Makes sense? And it gets all the way up to the CNS via retrograde transport. Mechanism of action, generally speaking, is a high-yield material for the board exams. Normally people look at it, and I encourage you to do so. It inhibits the inhibitory. So when we inhibit the inhibitory, شو بصير؟ بصير too much excitatory. Okay? مثل transcriptional repressors. سامعين بالtranscriptional repressors؟ هلا we transcribe genes. Okay? Produce a signal, the signal transcribes the gene starts firing mRNAs that carries transcribed to be translated into the protein that does the work. Okay? That's the story. There are transcriptional repressors that repress transcription factors and repress the gene transcription altogether. But when I knock out a transcriptional repressor, you would expect the gene to be overexpressed. صح؟ اللي مش متسحب فاهم شو حكيت. طيب. So in this case, GABA and glycine are your correct answer of choice when you answer this, preventing the release of the neurotransmitters. That's the mechanism. شو اسمهم النeurotransmitters? GABA and glycine from the inhibitory cells اللي يسمونهم الرانشا in the spinal cord, leading to increase in the muscle tone and hypersympathetic status. تمام؟ generalize زي ما شفتوا بالصورة في localize وفي cephalic اللي هو يعني in the cephalic area, in the head area, وفي the neonatal. There are two common keys or flags, and we frequently see them in the clinical practice as well as on the board exams. اللي هم teresmus يعني lock jaw and rigidity, and rhesus sardonicus. شو يعني sardonicus؟ rhesus sardonicus يعني شيطاني، اللي هو العضلات الاورس او الاوربيكولاريس اورس بتكون متشنجه لدرجه كبيره انه بكون مفتح عيونه كثير مثل الشيطان او so is the myth. واضح؟ But these are the two highlighted here, teresmus and rhesus sardonicus, for us to remember. The diagnosis, as you can imagine, is يعني we don't really do a proper microbiology because the history and the presentation is an enough testament that the person is suffering from tetany. Check. You agree? And some risk factors: accidental puncture wounds, umbilical stump for the يعني إذا كان tools that we use مش clean يعني not sterile enough, you might end up with that, crushed body parts, and so on and so forth. And the death, as you can imagine, is from respiratory failure. Treatment with antibiotics and diazepams to relax the body, and we always give the vaccine, DTaP, or the toxoid booster every 10 years. And that's the story of tetany. Okay? What you're seeing here is a protocol. Do we practice this in Jordan? I don't know. Nevertheless, there are 4 stages of how we approach someone with tetany based on the presentation and the duration. لأنه دائما يا جماعة مثل الستروك، لما نحكي stroke, it's a time sensitive business. If you treat with thrombolytic therapy in timely, you can literally save someone's life. هيك الشغل، check. So we have to be good clinicians, time. الوقت هون بيلعب دور، فبتشوفوا first few hours, 24 hours, next to 3 weeks, 2 to 6 weeks when we are discussing here physiotherapy, rehabilitation, and making sure they're getting their booster shot before we discharge them. بشكل عام, what we're looking at here is some antibiotics, flagyl, metronidazole, diazepams, securing the airway. ABCs اللي انتم بتعرفوهم، صح؟ بتعرفوا ABCs؟ صح؟ بتعرفوا ABCs؟ airway, check? Yeah. For the most part, this is what this is discussing, including something interesting that I did not mention in the talk, اللي هو immunoglobulin. Human tetanus immunoglobulin, 500 units intramuscular, alternatively IV, can also boost your body and your immune responses to recover from the toxin in a faster way. At the same time, as you can see, it's a lot of supportive, including the immunoglobulin in this case. Nothing to memorize here. كنتم حاضرين عشان make your life easier and you deserve it. And I thank you for being attended today. ما تحفظي شيء. الحكي اللي حكيناه بالأول, that's what you need to know for the exam. لأن الموضوع فيه امتحان, صح? For your clinical practice, similarly, what I've mentioned before is good enough for your clinical practice. If you want to dive deep into this and you think you'll be working in an area where there is a lot of rusty nails and construction workers and kids or geriatric age group, if you will, perhaps scan through this, read through it for your own enjoyment. لأنه أنتم لما تقرأوا المحاضرة, you should be enjoying it. صح? If you are not enjoying it, you are in the wrong business. ماشي؟ لازم يكون عندكم الشغف والنهم من تتعلموا الطب. صح؟ صح. طيب. Botulinum or botulism is another toxin-mediated peripheral nervous system paralytic illness caused by another one اسمها botulism, Clostridium botulism. It is a foodborne. In fact, it's one of the most lethal foodborne diseases. تمام. Undetermined etiology. هون شوي different. في عندنا foodborne، في عندنا الانفنت، في عندنا iatrogenic، وفي عندنا الانهيلد اللي could be possibly used as a bioterror agent. تمام. شو يعني iatrogenic؟ Yeah, more or less. For food botulism, foodborne associated with home canned and fermented foods. ليش حكينا home canned؟ لأنه here we are hinting at the fact that the food was canned or fermented in an inappropriate way. The sterilization technique wasn't optimal, it was suboptimal, and as a result we allowed the introduction of the bug. بنشوف الامتحان كيف بيسألك in the southern state, Georgia, South Carolina, where these people are known to pickle everything, and they like to home pickle a lot of things. The presentation will be as such, a southern state, the board exams, وبيحكي لك إنه the presentations of a paralytic illness with a neurological manifestation, then you can guess. إذا infant or less than 1 year old لازم يحكي honey ingestion, okay? لأن the spores will survive in the honey. مشان هيك احنا الأطفال اللي تحت السن ما نطعمهم عسل، صح؟ تعرفوا هاي النقطة ولا لا؟ سامعين فيها؟ تحت السن ما نطعمهم عسل. البلاك تار from heroin كمان الانجكشن needles similarly الموضوع contamination مش أكثر. تمام؟ هلا there are an A and a B of these toxins. A toxin from A to G في different flavors of toxins. وبصراحة كنت بدي أحطهم بعدين بطلت لأن it's too much information. اللي بيستخدموهم in the clinics, okay, to hide the wrinkles in the facial area اللي هم ال A and B toxins, okay? And as I said, it's a bioterror. تعرفوا ليش بصير عند الواحد wrinkles؟ شو بيعمل botulism أو البوتوكس؟ شو بيعمل؟ What paralyzes the muscle مش هيك؟ تمام، وكيف بصير الرينكل؟ Wrinkle comes with age مش هيك؟ Age, exposures, environment, stress إلى آخره. It's part of normal aging process. لأن أنتم بتعرفوا the submucous في عندنا الديرمس، في عندنا الإبيديرمس، صح؟ In the epidermis there are 7 layers. The stratus cornea. شو بتعرفوا 7 layers of the skin? The epidermis part of the skin, صح? The idea here إنه the cell is born or regenerated from the stem cell source at the bottom of the stratus cornea and start migrating, and as it migrates it loses its nucleus and becomes from cuboid into more fusiform. Check. تماماً تصل to the very top layer and then exfoliates. صح؟ طيب with aging and cells are replicating, part of the normal process بصير عندنا point mutations and death. When the death happens بصير ايش؟ بصير زي valve. Cells are regenerating and coming up from both sides, and from this side there is no cells regenerating. ففي زي gap، صح؟ ففي زي gap. هاي الجاب بتبين as a fissure, تبين as a rift or a wrinkle. لأنه there's a lot of facial muscles that we use more when we cry or when we laugh. When we laugh. The laughter is cute. دائما حاول تبتسم, including myself. And I'm trying to adjust. It's not easy. طيب. But when we laugh, we use more muscles. Okay. Anyways, so the muscles pull and then make that wrinkle more apparent. احنا شو بنعمل؟ We bring the toxin and paralyze that muscle. And once you start with the Botox, you cannot stop, and then you start needing increases the doses and the frequencies of these injections. And that's rather interesting. And I'll stop there. I'm not going to judge anybody. Like, so gram positive, strictly anaerobe, botulism toxin, canned foods. شايفين the pickle of cucumbers? Yeah? And it's the most lethal food poisoning, 12 to 20% fatality. The toxin, botulism toxin, بيعمل 4 Ds. diplopia, dystonia, dysphonia, and dysarthria, flaccid muscle paralysis, descending, لأنه you ingest the toxin, صح؟ Fever, الامتحان is not a symptom of botulinum toxicity. طيب دكتور شو الميكانيزم اوف اكشن؟ انت مش كاتب لنا اياها. العمده مش كاتب، انا راح اسال عنها. So here is the synaptic cleft. Okay? Neuron and the muscle. شايفين هذا النيورون end, synaptic cleft and the muscle. Release of what? هي مكتوبه بس يعني مش مكتوبه مشان الشبيب اللي بتغير. انتم متخيلين انتم 700 واحد. عارفين قديش هسه موجود هون؟ 50 60 you imagine? أنا لسه بعد مش فاهم الموضوع. طيب. So see how the acetylcholine being released into the presynaptic cleft. Check. And then the muscle gets the order from the nerve to contract or to relax and to conduct the function that it's supposed to do. When you have the botulinum here filling up the presynaptic cleft, prevent the release of acetylcholine into the presynaptic cleft, and that's the mechanism of action, preventing the release of acetylcholine to the presynaptic cleft, and that's the mechanism of action that you'll be asked on the exam. Used for cosmetic reasons to remove wrinkles. Why would you not remove wrinkles? Keep them. أنا لما أحطه I would keep them. Leftover food is another. إحنا قلنا canned food, fermented food. What about leftover foods? Could possibly be of an interest. Ingestion of food, honey, and corn syrup particularly leads to flaccid baby syndrome or hypotonia اللي هو decrease in the muscle tone. Flaccid baby syndrome, puncture wounds, and so on and so forth. Okay. Diagnosis again, similar to Tetanus. Diagnosis in this case is based on history and clinical presentation. You can culture it and you can provide the supportive care. Supportive care here is ABCs again, including the botulinum immunoglobulin. Baby Big is available for treatment of infants less than 1 year old, and the hepatovalent botulinum antitoxin is also available for non-infants. America, I'm sure available or not. This is the treatment. This is how we get things moving faster. Well, otherwise, it's supportive treatment, foodborne diseases, or food preparation prevention, and that's that. And there are no current vaccine for botulinum. And that's the story of botulinum in few minutes. سؤال أسئلة؟ No? Good? Listeria. Listeria حكينا عليها بالمننجايتس. سمعنا حقها. It was only one slide. فاليوم راح نحكي عن this facultative intracellular organism. لما نقول facultative شو يعني؟ يعني it can live inside, prefers to live intracellularly, but it can also exist extracellularly. Check. So that's the story, gram-positive, non-spore forming, and it doesn't have a complex nutritional requirements. The thing that you should remember, and there is a picture of cheese in here for that. Include dairy products, cold cuts, يعني cold cuts. Cold cut. طيب cold meat cut شو يعني؟ اللحم البارد. شو يعني لحم بارد؟ يعني لما تروح على تفضل. لما تروح على السوبر ماركت، طبعا بفوتوا بيطلعوا انتوا عارفين. تروح على السوبر ماركت تطلب مارتديلا مثلا أو صدر تركي حبش، صح؟ أو beef أو chicken. The bottom line, cold cuts. That's the story. Coleslaw is another. Soft cheeses. فبكون her first pregnancy وبدهم يروحوا مثلا to France on a honeymoon. There is a name for the honeymoon تبع ال first pregnancy. تعرفوا شو اسمه؟ Google it تحب. تمام؟ On her first pregnancy بروحوا to France and they try cheeses. The French people don't like to boil their milk. They like, so you will find a lot of unpasteurized cheeses in France. Come on home, تمام? And if you ingest that, you are running the risk of contracting the disease. The disease itself ما راح يأثر على pregnant lady, but it will affect it will affect the fetus. It will be the present or the gift that the unplanned pregnancy and unscreened pregnancy mom and that, for that matter, is provided to the newborn child to the slide. Before we get there, I want you to look at the tumbling motility on the slide. This is a characteristic feature that we normally ask on the board exams as well. Tumbling motility. The other feature, اللي هي بالgrowth, you see an umbrella zone of growth. You see the umbrella here? شايفين هذا الليكويد broth؟ شايفين هاي الامبريلا؟ تمام. So هاي الامبريلا مثل السيدة ملعقة. تعرفوش طبعا السيدة ملعقة. حدا بيعرف السيدة ملعقة؟ لا ولا حدا؟ طيب. Erythromycin, ampicillin, and that's that. So زي ما انتم شايفين الجروث temperature, the optimum growth temperature for it على الكولد مش على 37 مش هيك؟ And thereby the cold cuts and the unpasteurized cheeses, tumbling motility, umbrella zone of growth. This is the one. The toxin اللي برضه common exam questions بيكون على the Listeria toxin. Listeria بيلعب بالPH. شوفوا شيء intracellular. It's an intracellular bug. ومين اللي surveillance? Who is your innate immune responses that will get in and try to attack it? One of them is macrophages, neutrophils, macrophages, and the other ABCs اللي حكينا عليهم before, antigen presenting cells, مش هيك? But when it gets engulfed, one of the mechanisms for the macrophage to clear the bug is to do the autophagy, autophagosome lysosome fusion to kill it. فهي بتعمل ايش؟ بتعمل acidification for the phagosome. So activated within the acidic phagosome, and then it will lyse the phagosome, and then it will escape and grow intracellularly as if it's in a Trojan horse اللي حكينا عليه before. تمام؟ To escape from the phagosome into the cytosol without damage. The trick here is playing with the pH. So, cytosol activity is maximized at pH 5.5, activated within the acidic phagosome, اللي هو 5.9, of cell that have phagocytosed. And this is how it evades the host innate immune responses, playing with the pH thanks to the toxin, Listeria O. That's the name of the toxin, and that's the answer on the exam. We can look at the Listeria O here in the image. Here, here, شاف يلا. هاي phagocytose, هاي Listeria فاتت مشاك, فاتت and then start activating, and then it replicates and then it exits. لما تروح على السايتو شايفين هاي الاكتين تعمل cytoskeletal rearrangement. After it escapes the phagosome lysosome, بتروح على cytosol of what? Of the macrophage. لما تروح على cytosol of the macrophage صار بتعمل شيء بيسموه cytoskeletal rearrangement للاكتينز. الاكتين اللي هو بعض الشيء للماكروفيج مش هيك؟ So it can exit successfully from there. And then it can go and infect another macrophage as well. Very successful. Bottom line زي ما حكينا لكم على قصة على شاف شو اسمه الهانيمون, the first pregnancy honeymoon شو اسمها؟ أنا ناسي لو بتذكر بحكي. ما بعرف بقول على طول. pregnancy بس وين المشكلة؟ المشكلة هون. خلينا نيونيت. شو يعني نيونيت؟ شو النيونيت؟ من صفر لشو؟ 1 month. Neonatal meningitis. Disaster. Permanent damage to the immature growing neuron cells that will not reverse, and it causes rather very damaging IQ, mental retardation, you name it, as a complication of this infection. That is rather easily preventable. تمام؟ راح نخلص اليوم بالتفرسي. شو طلع التفرسي بالعربي؟ الجدار. طيب. أنا بتذكر التفرسي خلص يلا طيب. اوكي سو ليبرسي له اسم اسمه هانسن ديزيز، واذا بترجع على هانسن على الاغلب راح تلاقوا one of the kings in England. الله اعلم. انا ناسي. Mycobacterium, not tuberculosis. Leprosy. Okay? So it is a mycobacterium that caused leprosy. It likes cool temperature and infects mucosa and the superficial nerves, gloves and stocking. ايش يعني gloves and stocking؟ يعني the peripheral nerves that are affected are the ones that are normally covered by the gloves and الجوارح. Cannot grow in vivo, United States, الهوست or الانيمال الارماديلو احنا خلصنا؟ armadillo. طيب armadillo. There are two forms, the lepromatous and the tuberculoid leprosy. الامتحان او اذا حدا راح يسالكم عليه راح يسالكم على هذول التو فورمز هيك مختصر فيه تمام. This one will appear as lion-like. شايفين البيكتشر؟ leonine or lion-like. The high bacterial load is characteristic and can be lethal. This is lepromatous leprosy. The tuberculoid لا low bacterial load وبتعطيك hairless skin plaques like this. تمام؟ هيك the easiest explanation for today's talk on leprosy. Okay? Diagnosis with PCR, with treatment with dapsone and rifampin for the tuberculoid form, and for the lepromatous form we use clofazimine. Right. Now, if you want to compare and answer the exam question, I encourage you to go through this slide. And for example, the infectivity is high with the lepromatous, it's low for the tuberculoid, the skin lesion, the immune response, and so on and so forth, and the histopathology, and so on and so forth. So try to distinguish the differences between the two. لأنكم حاضرين أنا راح أسأل على هدول بس. يعني for my part of the story. Okay? For the board exams, I encourage you to review this. Okay? But here you look at the lion-like, lethal with high bacterial load. This is lepromatous. Tuberculoid زي ما حكيت بس. Hairless skin lesion with low bacterial load. That's more than enough for you. Okay? And that's it. Alright? For the board exams, for those interested in Northern American experience, you should look into this. And I will leave you with this. This is the cherry on the icing. You could remove this slide or you could look at it for fun and enjoyment. كبروز، أغروش، شوفوا different skin lesions, their manifestations from the histopathology to the staining, to the appearance, and the type of the lesion, all the way to the immune response. I like the image, so I put it out here just for your record. Okay? So we already know what to know from Leprosy, causative agent, and the two forms, diagnosis, treatment, and that's it. سهل, easy, صح؟ lemon squeeze. يعطيك ألف عافية.